So the Voice Center was set up as a multidisciplinary center to take care of the human voice, essentially. So we have lots of issues with our voices because of overuse or other types of problems, and we set up a center basically to take care of that particular problem. So I would say that the majority of our patients are not professionals in the sense that most people consider professionals. Most people think of a voice professional as a singer, maybe in the opera, or an actor. We have certainly plenty of folks like that, but the vast majority we consider are voice professionals. Those are those who rely upon their voice to perform their job. So the majority of those folks tend to be teachers, lawyers, telephone operators, salesmen, all sorts of people who basically need their voice for their living. And in fact, in today's age, the vast majority of jobs rely upon their voice, either for telephone calls or sales calls or things along those lines. I think what makes us unique to some degree is there's a multidisciplinary nature of us. There are many sort of physicians out there who take care of what they call professional voice. So they see the patients, they'll diagnose them, and then they'll send them off to somewhere else. And we have all of that sort of in-house. So we have the rehab people that work with us directly that are there at the time when the patients are there. So we evaluate them all together. And then if, for example, for the professionals, oftentimes they need help with their singing. We have people within the center that actually teach singing so that we can not only help them with their voice, but also help them with their singing, and they actually get involved. Those folks are the ones who get involved with the producers in the show to help them modify their roles, and so they can go back and, it's a seamless experience from start to finish. The majority of patients who have voice issues will come in complaining of plain old hoarseness. So, the average everyday hoarseness that you consider as a symptom, they'll come in with that complaint. So for those folks who tend to rely upon their voice on a regular basis, the majority of reasons why they come in is because they've created an injury or damage to their vocal cords. And that can happen most commonly with an upper respiratory infection. So you get a cold and you cough or you clear your throat a lot, and you can create an injury to your vocal cords. Fortunately, most of that is temporary, and the majority of people within 2 weeks will resolve that particular problem. Those folks who have a longer issue that lasts beyond 2 weeks may have created a more permanent injury, and those are the folks that we oftentimes see that we need to treat. The common complaint that comes in with this Broadway type thing is basically they come in on a day, and on their day off typically, and they'll say that they can't perform the way they want to perform. They have pain, they have discomfort, they're out a lot, and that they need to be back ASAP, or their understudy essentially will take over their role, which is a very big deal for them. And so that's a very kind of common thing that we see. So the treatment of voice disorders oftentimes includes both behavioral management, as we call it, which means voice therapy, sometimes medications, and sometimes surgery. The very standard thing that's done for a lot of these folks is to give them steroids. And so the traditional, what you sort of used to seeing is an opera singer or a Broadway star coming over and getting a shot that essentially is a steroid shot that will decrease inflammation. But we're very careful to explain to them that that's really just a Band-Aid for their problem, and that really they need a longer-term solution. Otherwise, they're just going to be back in the office in several weeks with another problem.